This segment of Delmarva Life is brought to you by Peninsula Home Care.
Whether you're recovering from surgery or you have wounds that are a result of diabetes or peripheral vascular disease, healing can be dependent upon the expertise of skilled wound care nurses, like the ones at Peninsula Home Care. They're not just skilled, but wound care certified. And I'm with Jessica Lewis and Claire Wheaton. They are both wound care certified nurses. Ladies, thank you for being here today. So Jessica, I'm going to start with you. Tell us about Peninsula Home Care and what the nurses do at home for wound care.
Well, to begin with, we treat all kinds of wounds. All of our nurses can treat wounds. We do anything from diabetes management wounds, peripheral vascular disease, surgical wounds, to even pressure ulcers and venous stasis ulcers.
Okay, so this is something you do at the home. Correct. What's the benefit of the patient being home as opposed to like a wound care facility?
The patient being in their home, they're more comfortable. They're in their normal surroundings. The infection rate is a little lower. They have the comfort, and patients heal better when they're at home.
Yeah. Okay, so Claire, what are the advantages of having a certified wound care nurse for advanced wound care in the home?
Well, certified wound care nurses went through additional education, so they're better able to communicate with your providers and to come up with a treatment plan to help the patient heal as quickly as possible.
And these wounds can sometimes get complicated, can't they?
Yeah, they're often complicated by other medical diagnoses that that patient might have going on.
Okay, so Jessica, can you tell us a little bit more about the comorbid diagnosis that complicates that wound care?
Sure. There's diabetes, peripheral vascular disease, venous insufficiency, poor protein intake. With that being said, peripheral vascular disease and diabetes, they restrict the blood flow. And as we're taught in our wound care certified nursing course, you have to have a healthy patient and a healthy wound to heal the wound.
So what are you doing to manage those diagnoses?
We teach the patient as a whole. We teach why diabetes management or why taking their medications is appropriate and help the healing, and why good nutrition to heal as a whole and underlying causes.
That's important that they know
absolutely
what they're doing. Okay, so Nurses Week, obviously last week. Share your insights on how a person can reduce their risk for wounds and I guess infection or further complications.
Well, prevention is always the key to prevent the wounds to begin with. So, it's a healthy diet, exercise, following up regularly with their providers. For anyone with diabetes or peripheral vascular compromise, to see a podiatrist for skin checks and toenail care, but really just preventing the wound to begin with. And then checking your own skin. As soon as you notice something, calling your provider to address that quickly.
Well, thank you both for all you do to keep your patients healthy and living a productive life, even when they're dealing with something like this.
Thank you.